Okay, the centre has rushed high-level public health teams to Maharashtra and to Punjab to assist in COVID-19 controlling and the containment measures in view of the recent spike in cases in these states. Let's go across to Sukirti, who is following this story. Sukirti, so it's really a race against time as our vaccination drive goes into fifth gear. We're also racing against cases rising right now in these two critical states.
Well, absolutely. And now the centre has sent teams to both Maharashtra as well as Punjab. And what is also significant is the level of senior officials that have been sent to both of these states. In the past also, there are officials from the Ministry of Health as well as the National Centre for Disease Control who visited these states. But this is the first time that we are seeing the NCDC head himself visiting Punjab. He's leading that team. And similarly in Maharashtra, there is a very senior official of the Disaster Management Cell of the Health Ministry who is headed to this state of Maharashtra. So all of these central teams will be looking at the reasons behind the surge, what are the causes, what are the measures they need to take with regard to testing as well as contact tracing, how is that supposed to improve. And at the same time, the centre has also recently just released a report of what is it that the last central team found in Maharashtra. A 3-member team had visited Maharashtra on March 1st and 2nd, and the centre has now released a report where they have said that while the exact causes are not known, there are certain reasons behind the surge that our 3-member team found, and those are mainly the fact that people are not following COVID-appropriate behavior anymore. There is no fear of the disease anymore in people. They are not as forthcoming in getting their tests done. Similarly, there is the health machinery of the state has also become a little lax in the sense that both government as well as especially private doctors, if there are patients coming to them, so a lot of them are being simply dismissed as flu instead of being asked or counseled to go for a testing. So, and there have been discussions with Maharashtra as well. There are certain suggestions that have been given to Maharashtra. Maharashtra in turn has made its own suggestions saying that, yes, we will be ramping up vaccinations as well, but the centre needs to give us a lot more flexibility in terms of deciding our timetables or including private hospitals. And the central team had visited places like Nagpur, Pune, and all of these places that had seen a surge. So definitely centre keeping a very close eye on the surge in cases, and states now asked to take tough measures.
Sukirti Trivedi reporting on this huge challenge for the government right now. Thanks for that, Sukirti.